Well, it appears this year's flu season has hit with a vengeance. Already 1,000 Victorians have fallen ill, many more than at the same time last year. 7 have died and dozens have ended up in hospital. Doctors' best advice is to get a flu shot and wash your hands frequently.
It's the season for it, but most of us don't want to get it. Already 8,000 people have been diagnosed with the influenza virus nationwide. In Victoria, there's been nearly 1,000 cases. That's up from 700 last year. The severity of the flu this year is the worst it's been for at least 3 years because this particular strain has been dormant.
That particular family of viruses does tend to cause the worst outcomes. It causes more severe disease, it causes more hospitalisations, and unfortunately it causes more deaths.
The number of people being treated for respiratory problems in Victorian hospitals has also doubled, and those with existing health issues are more vulnerable.
Well, flu not only makes people sick, but it exacerbates underlying conditions such as diabetes, heart disease, respiratory disease. And with respiratory disease, it's a potent precipitant of pneumonia.
The other high-risk groups are young people and the elderly. Experts say the best way to protect yourself is to make sure you wash your hands, try and stay away from crowds, and most importantly, get vaccinated. But if you do get the flu, there are medications to help your recovery.
There are a couple of quite effective drugs out there which we can use if you are unlucky enough to be infected with this year's influenza, and they're called influenza antivirals.
Doctors say over-the-counter drugs only mask the symptoms and don't actually treat the virus. Gloria Claish, ABC News, Melbourne.